So, cut off again, I'm back. That's probably going to happen quite a lot until I work out how to kind of increase the memory or whatever you do with these phones. I'm not very technical. So yeah, it turns out it was because I was so doped up on the drugs and medication, and that this guy whose name was Ejike was so black, and my head must have been playing tricks. So that went on to be quite a kind of funny joke in the ward. That was just a wee story for you. Moving on, I had to be bed bathed for weeks. When I say I wasn't allowed out of bed, I wasn't even allowed to sit in my chair. It took weeks for them to be able to get my body in such a fit state that I could go with two people transferring me from the bed to the chair to sit up. When I eventually did get to sit up, I still had the drains coming out of me. My operation, like I said, or did I tell you? I don't know if I did, but when this surgeon went in to do this part of the operation, he managed to do it keyhole again, which was amazing, but he did manage to do it. I had staples in the keyhole wounds that I had. I have multiple scars on my abdomen. I don't want to tell you too much because that's further on in the story, but at that time I had the scars from when the band went in, which was about 6 to 8 kind of small scars, the biggest one being probably about 3 inches. And then it was the same again, but just slightly off of the previous scars because they don't like to open an old scar, because it promotes something called keloid scarring, which is when your body overproduces tissue to heal an area and it causes a lumpy scar. Sometimes you get that even if you haven't had an old scar reopened. It's just the way the body works and it's just the way it tries to heal itself. The staples were good in the fact that they kept the wound closed, but because my immune system was so low, the specialist actually considered put me into isolation because my immune system was so low, but for whatever reason they decided not to. Anyway, because my immune system was so low, my body wasn't doing well at healing itself, so the staples, they did stay in place and they kept the wound closed, but the actual wound wasn't healing well at all. It would basically heal slightly and then slightly open, heal slightly, slightly open, and so the cycle continued. And this went on pretty much for the duration of my stay in hospital. The wounds were cleaned and things as they should be. It was just that my body was so knackered that it just wasn't healing. When I was at the stage to be transferred to the seat, I found there was a lot of discomfort from the catheter. The catheter tube is inserted into your urethra. It has a balloon on the end of it, and basically when the tube goes into your urethra, they then use a syringe with sometimes about 10 mils of saline fluid. They put it in slowly, they inflate the balloon in your bladder, and that basically anchors the catheter in your bladder so as it can't come out. It can if it's pulled or things like that, but it shouldn't. From there's a hole and that drains the urine into a bag. When I was sitting up, obviously I hadn't sat up for so long that I wasn't used to feeling the catheter when I was sitting, so I had a lot of discomfort there. Not pain, but more, and anxiety, I would say, just in case, you know, it got caught or someone tripped up. Oh, I was so paranoid that someone would pass by and kick my catheter bag and pull it. Oh, I don't even want to think about that. So yeah, I also had actual pain that was still really, really sore, but not at the excruciation. I had experienced at that point the 10 out of 10 pain. So at this point I'm telling you about, I would have said the pain was about a 6. It was bearable with medication, but had I not had the pain meds, it would have been excruciating. It would probably have been back at the 10. Where was I going with that? I've got so much to tell you that I'm getting sidetracked. So yeah, I had pain in the wound areas, and especially round about the areas where the drains were. Over maybe 3 or 4 days from when I was able to sit up in the seat, the pain worsened in the drain areas, and it was getting to the stage that even morphine wasn't killing this really like burning hot stabbing pain that when I was being moved, it was horrendous. I mean, it brought me to tears. It was just awful. It then turns out that I had developed an infection in the drainage sites. That's something that can't be helped. It's something that happens, even though nursing staff, they look after, you know, the areas and they clean it and things like that. It's still something that can happen. It can be because of the septicemia in you. It can be, well, if you have it, it can be you know, just stray bacteria getting in. It can be sweat gathering, you name it. So I developed an infection, and basically one of the junior doctors at the time, known as an FY1 or 2, I can't remember if it's 1 or 2 in high dependency, because I've not worked high dependency, decided that there was no infection. It was obvious there was infection. Not only was it still draining this green fluid constantly, the wound area round about where the drains were in was starting to get red, inflamed, hot to touch. There was a slight smell coming from it. It was leaking, all signs of infection. So if I know that, or I knew that at the time, and everyone else knew that at the time, it beats me why a junior doctor would not know that. Sometimes, no offence to junior doctors, I know everyone trains, but sometimes I just think, my goodness, the one thing about common sense is it's not very common. It really surprises me at the lack of knowledge and the lack of training in certain areas that junior doctors get. They tend to go on the policy of see one, do one, qualify. I'm not a doctor, but as I say, I'm in healthcare, and I have trained junior doctors to specifically perform venipuncture, which is taking blood. Some of them have been really good and taken any training that they could get and spent time with me and stuff. Others are like, no, we see one, do one and qualify. For the record, if there's any junior doctors watching this, please, if someone is offering you help and going out of their way to help you with your skills, take it. There's no shame in, you know, learning or asking questions or not getting things first time round. It'll make you a better professional. And that's coming from someone who has worked to that theory as well. This video is reaching about 10 minutes at the moment, so it may cut off again. If it does, I'll just continue in another one. So the consultant eventually came round at done the surgery, and I said to him that this pain was getting unbearable in the drainage sites. He had a look and he said, it's clear there's infection there, we need to get that under control. Again, it was like trial and error with antibiotics and all that sort of stuff. Again, still all IV. I'm going to jog on a wee bit because this went on for weeks.